Regaining knee extension is one of the most important things that you can do after ACL surgery. Knee extension is essential for normalizing the mobility of the knee and regaining muscular control to help to normalize walking. But not only that, knee extension is also critical to returning to running and jumping. So if you have any hopes of returning to sport, you need full knee extension. And I mean full knee extension. That means if your knee on the non-injured side hyperextends, which most of us does, you need to regain that motion. And the longer it takes to get back, the stiffer the knee can become, which can increase your risk for secondary injuries and delay the return to sport and physical activity. So restoring knee extension early after surgery is crucial to optimizing post-surgical outcomes and reducing the risk of long-term complications. So in this video, I'll be reviewing 4 of the best exercises you can perform to regain knee extension mobility right after ACL surgery. The best way to regain motion, no matter what part of the body we're talking about, is attacking it from different angles and targeting multiple muscles and joints. And when it comes to ACL surgery, you need to address everything from swelling, joint stiffness, and muscle spasms, which inevitably occurs due to the trauma and period of immobilization after surgery. The first exercise I recommend for patients is an assisted terminal knee extension exercise, specifically targeting the knee joint. This exercise utilizes the elasticity of a band to provide an assisted stretch. To perform this exercise, place the band just above the kneecap and adjust the tension to provide a light stretch. Secure the band around a stable object. I typically use a thicker exercise band, but a normal TheraBand can also do the trick. Begin by raising up on your toes and then driving your heel down into the floor by engaging the quadriceps muscle. As the heel touches the ground, you should feel a gentle stretch as the band aids in the knee extension motion. Complete 20 repetitions of this exercise, holding each repetition for 5 seconds. A muscle that I find most people forget about when it comes to regaining mobility after ACL surgery is the calf muscle. The gastrocnemius muscle crosses right behind the knee and not only points the toes down, but also flexes the knee. So if it's tight, then it will also limit the knee's extension mobility. So it's a good muscle to address early on after ACL surgery. An easy stretch to reduce the tone of this muscle and restore its mobility is a sprinter stretch. Place your hands on a table or wall and set up in a lunge stance with the targeted leg in the back. Keeping the back heel down, slowly lunge on the front leg until you feel a light stretch in the back of the calf. Hold this for 5 seconds and repeat for 20 repetitions. Go deeper into the stretch with each rep, keeping the stretch light to allow for relaxation. Avoid aggressively stretching. A little stretch goes a long way. Next, we will hit the hamstring muscle, another muscle that crosses the knee and commonly spasms after surgery, limiting knee extension mobility. Like the sprinter stretch, place your hands on a table or a wall, but instead of positioning the targeted leg behind, put it in front of you. Keep your foot flat and slowly lunge backwards on the back leg while keeping the surgical knee straight until you feel a stretch in the hamstring muscle. Hold this position for 5 seconds and repeat it for 20 repetitions. Again, make sure the stretch is light. Lighter stretching allows for muscle relaxation. Now that we have addressed both the joint, calves, and hamstring muscles in isolation, let's now finish up with a more combined stretch that hits everything at once. For this exercise, you will need something to put under your toes. I'm using a towel, but you can use anything. Roll up the towel and place the forefoot of both legs on it. Straighten your knees by squeezing your quadriceps muscles. Keeping those quads squeezed, bend forward and try to touch your toes until you feel a stretch in the back of your legs. Hold this for 5 seconds and repeat for 20 repetitions. This is a great stretch to finish with as it hits everything all at once. But of course, consult your physical therapist prior to performing these exercises. I usually recommend patients perform mobility exercises 3 to 4 times a day for the first 4 to 6 weeks after surgery until full motion is restored. As these mobilizations become more tolerable, feel free to increase the duration of the stretch to 4 sets of 30-second holds. But again, keep the stretch light and tolerable. And remember, it's not how hard you perform these exercises, it's how often. Mobility should come back relatively quickly and easily if you are consistent with your exercises. And don't forget about swelling management. The more swelling in your knee, the stiffer it will be. So remember, elevate your leg when you're laying down above the level of your heart and wear a compression sleeve during the day until swelling is gone. I have included links in the description for a compression sleeve that you can wear throughout the day. Well, I hope you enjoyed this episode of Physio Show. Don't forget to support the channel if you found this video valuable by giving the video a like. And subscribe to the channel so you can stay up to date about your body, how it works, and what it needs to keep moving.